Fortunately, most of the measurement tools that we are talking about actually can be done self-rated, and in the process actually does not add significantly to the time of the clinical visit, and therefore the clinical visit ends up being something that you can use for really careful decision making rather than just inquiry about how their sleep was or how their appetite was. We really have to be thinking about this on an ongoing basis so that we both do use these measurements for diagnosis, for severity measurements, and most importantly for treatment matching. When I say measurement-based care, there is a tendency for people to think that just using measurement-based care, meaning using measurements, will therefore drive treatment on its own. I want to be careful to clarify that measurement-based care means you are assessing standardized tools, using standardized tools to measure assessment of symptoms, function, side effects, patient adherence, and this will then guide you in a decision-making process. So measurements are just the first step that then allow you to make clinical decisions based on different things, including guidelines, et cetera, and we'll talk about it. But we should not think of these measurements as a substitute for clinical judgment. Again, as I mentioned earlier, my sense is that these routine measurements on a regular basis actually make clinical judgment even more important and more targeted, and therefore hopefully our outcomes for our patients will get better.